All right, welcome to part two. All right, so Schmoogly is our next case. All right, he's an 11-year-old male neutered pug. 4 weeks ago, he was diagnosed with congestive heart failure caused by degenerative atrioventricular valve disease. So it could be, we'll say it's the mitral valve. Based on his clinical signs, okay, it was suspected the mitral valve was involved. He's being treated with furosemide. He's also being treated with an ACE inhibitor and pemobendin, and he's here today for a recheck. So this is a chance to kind of look at a little pharmacology and to look at these two heart drugs. So so to understand to understand ACE inhibitors, let's talk a little bit about cardiac output and blood pressure. So you remember that cardiac output's the amount of blood that the left ventricle will pump in 1 minute. In a mouse, it might be this much blood, and in a horse, it might be this much blood, right? It's controlled by heart rate, which is beats per minute, and stroke volume. Stroke volume is the volume of blood that left ventricle will squirt out in one beat. You put that together, you multiply heart rate by stroke volume, and you're going to get a volume per minute. Now, why is this important? Because cardiac output plays a big role in supplying oxygen, glucose, and nutrients to your organs, your brain and heart in particular. And if cardiac output becomes low, maybe a drug overdose, maybe blood loss. If cardiac output becomes low, then guess who gets starved of oxygen and other nutrients? These guys. So we care very much about keeping cardiac output normal. Now, cardiac output is part of blood pressure, and that's really the big picture. Cardiac output influences blood pressure, and then the other thing that influences blood pressure is SVR, which stands for systemic vascular resistance. So if cardiac output goes down, so does blood pressure. If SVR goes down, so does blood pressure. If cardiac output goes up, so can blood pressure. If SVR goes up, so can blood pressure. Well, what is SVR? It's just a fancy way of describing a very important concept. It describes whether blood vessels are dilated, which we call vasoconstriction, or if they're constricted. I'm sorry, dilated is vasodilation, constricted is vasoconstriction. And in particular, SVR is affected by the vasodilation or vasoconstriction of peripheral blood vessels, peripheral arteries, or peripheral arterioles. And people sometimes have problem with this concept of peripheral. It just refers to vessels in the outer parts of the body, the skin, the extremities, the ears, your nose, right? These are not, they're important. These are important blood vessels, but they're not as important as the blood vessels to your brain and your heart, okay? These are peripheral blood vessels. If you've noticed how on a cold day, your hands get cold, your feet get cold, your honey bunch maybe sticks their cold hands on your back and scares you, and then they say things like, "Oh, but you're so nice and warm." Well, the reason their hands and feet, or your hands and feet, get cold is vasoconstriction. Your body doesn't want to lose excess heat to your cold feet, so those blood vessels constrict, and if that gets severe enough, it can lead to frostbite. But again, that's just these peripheral blood vessels constricting. If you've ever used a nasal spray like Afrin, if you have a plugged up nose or nasal congestion, Afrin causes peripheral vasoconstriction to these peripheral blood vessels, right? That's how suddenly you can breathe again. And just to throw in my old friend, the various adrenergic receptors, nasal sprays are agonists to alpha 1s. The flip side is acepromazine causes peripheral vasodilation. We don't really like that during anesthesia, but it is an alpha 1 antagonist. This is what, but we can also use acepromazine on a horse with laminitis. Some people think it helps improve blood flow to the lamina. That's nice. And we use it if we need to clean a horse's sheath because it'll cause vasodilation of the penis, and then we can get his penis out and check for tumors or clean the sheath. Something else we won't have time for. Well, we might. We'll see. Okay. Anyway, what does this have to do with schmoogly? So this just shows you, and this is mitral valve regurgitation again. So you see when that left ventricle pumps, you can see some of the blood being pumped the wrong direction. So that's causing congestive heart failure in little schmoogly. And so I want to talk about how what's good for the kidney is bad for the heart. But to do that, we're going to review something we learned last year, which is called, it's all about aldosterone, but it's called the renin-angiotensin-aldosterone system. So let's just take normal. Okay, so normal, you're being attacked by a shark and you're losing blood. And for some reason, your blood is orange. I don't know why. So you're losing blood and your blood pressure drops. That's going to set off this reaction that we'll talk about in a moment. That is going to, one of its purposes is to tell the adrenal gland to release aldosterone. Aldosterone is one of the two hormones that comes from the adrenal cortex. What's the other hormone? Cortisone, right? A glucocorticoid, another stress hormone. So both of these hormones are trying to help you deal with stress, but we're just talking about aldosterone. So aldosterone, it does two things. Aldosterone is, in some ways, it's kind of the opposite of furosemide. It's going to increase reabsorption of sodium by nephrons, and water will follow. So you'll have less water in your urine, and it'll get reabsorbed into your body. More fluid in your bloodstream is going to help help counteract the blood you've lost. The other thing aldosterone does is it causes these peripheral arteries to constrict, right? It's going to cause the blood vessels to your nose and your skin and your fingers. It's going to make them constrict. That way, it's rerouting blood to the heart and the brain, right? We've lost blood. So what little blood we have, let's send it. Let's not send it to your fingers. Let's send it to your brain. So we're going to basically, it's kind of like, cutting off a road, a side road, or limiting traffic down a side road. Together, increasing the blood volume is going to increase stroke volume, and that's going to increase cardiac output. Oops. Oh, shoot, that didn't work. Well, that didn't quite work. What happens then is, ignore that little heart. What happens is your blood pressure goes up and you survive the shark attack. Okay. Make sense? Sort of? Now, the problem is the same thing happens with heart failure. So here's a patient in heart failure, and the heart can't pump, and so the patient develops low blood pressure. That sets off the same reaction with aldosterone doing all the things it does to raise blood pressure. But that is not good for the heart. That makes actually more work for the heart. The heart is trying to lower its blood pressure to make less work, and the kidneys are raising the blood pressure because the kidneys don't know the difference. All they know is that there's low blood pressure. Now, we're going to look, this is sort of the simple version, believe it or not. To understand ACE inhibitors, we need to look at what happens right here. Right, there are several steps that occur right here. So bear with me, and I think it'll be okay. So again, right, same as before, you've lost your weird orange blood and you've got low blood pressure. So the first thing is the kidney releases this hormone called renin. It's an enzyme actually, but we consider it a hormone. And what this enzyme hormone does is it converts angiotensinogen into angiotensin. Angiotensinogen is made by the liver, and so renin is going to turn angiotensinogen into angiotensin. And then there's this enzyme that's found in the lungs, actually, called angiotensin converting enzyme. ACE stands for angiotensin converting enzyme, and it's going to convert angiotensin 1 into angiotensin 2. Angiotensin 2 has two jobs. One is it is what tells the adrenal gland to release aldosterone. And its other job is it's even better than aldosterone at causing vasoconstriction. And I mean peripheral vasoconstriction. So this is the same as the last slide. I'm just showing you these other steps here. And so again, what happens is blood pressure increases, aldosterone retains sodium, and now your blood pressure, you can deal with some of the blood you lost from the shark attack. But again, it's bad for the heart. Well, let me back up. This is fine if it's blood loss or dehydration, but if the low blood pressure is not from blood loss, if the low blood pressure is not from dehydration, if the low blood pressure is from heart failure, this whole thing is bad. This whole thing is making life worse. But the kidney can't tell. The kidney can tell there's low blood pressure, but it thinks everything is a shark attack. It thinks everything is dehydration. The kidney never thinks, you know, this low blood pressure, maybe it's heart failure. The kidney never thinks that. And so it starts to raise blood pressure, and the heart is saying, kidney, stop. I'm already a failing pump. Don't make life harder for me. So that's why we say what's good for the kidney is bad for the heart, and vice versa. The kidney likes high blood pressure. Well, it likes not high blood pressure, but the kidney likes a strong blood pressure. The heart does not really like a strong blood pressure. Okay, so ACE inhibitors, they prevent that peripheral vasoconstriction by preventing formation of two things. They're going to prevent the formation of angiotensin 2. That's the most potent vasoconstrictor in your body. And then, of course, we said angiotensin 2 tells the adrenal gland to release aldosterone. So you'll also be preventing the release of aldosterone. So together, this prevents peripheral vasoconstriction. That's going to decrease the the systemic vascular resistance. That's going to lower blood pressure. That'll create less pressure for the left ventricle to have to pump against. That creates less work for the heart. And it's actually less afterload, a term you learned last year. Okay, so just to show you, again, here's our little heart failing. That's Schmoogly's heart. This time, though, we're going to give Schmoogly an ACE inhibitor, right? So it's going to take this enzyme out of the picture. So I want you to use your imagination. If we prevent that enzyme from working, what's going to happen? This, right? Blood pressure will not go up. It will not make life hard for Schmoogly's kidney. The other drug that we really, really love is pimobendan. This was really a game changer when it came out, because before this, all we had was digoxin, which was a chronotrope. I'm sorry, it was an inotrope. It made the heart beat with more strength, but it had a really narrow therapeutic index. Pimobendan is much safer. So again, it's a positive inotrope. And trope means it has some effect on tissue. And then, oh gosh, I'm forgetting what ino means. But a positive chronotrope would increase heart rate. A positive inotrope increases the strength of a contraction. Pimobendan is also a vasodilator. So it's going to dilate peripheral blood vessels. And again, that will lower blood pressure some more, create less blood pressure for the heart. So it's really a wonder drug. And they combine these two terms, inotrope and vasodilator, to call pimobendan an inodilator or enodilator. And it's the only drug like it in veterinary medicine. Okay, let's look at our final case. This is, no, not our final case. We have two more. So this is Tipitina. So take some time and look over Tipitina's questions. I'll wait. Hit pause. Okay, Tipitina, 5-year-old female spayed domestic shorthair. Her original presenting complaint was vomiting. She never showed any respiratory signs. A CBC reveals eosinophilia. Chemistry panel and urinalysis are normal. A heartworm antigen ELISA is negative, but the heartworm antibody ELISA was positive, and a single heartworm was visualized in her right and left pulmonary arteries using ultrasound. In other words, echocardiography. Okay, so hopefully you've already tried to work through these questions. Let's do some heartworm reviewing. This is a cat with heartworm, and you'll see it's a very different disease than in dogs, but we're going to talk about dogs and cats. So first, this is a kind of a review from parasitology. This is the generic life cycle for all nematodes. Could be roundworms, whipworms, hookworms. They all are adults, male and female. They create offspring that are in this larval stage. We call that L1, first stage larva, and then the second stage larva. And they just molt and they grow until they reach adulthood, and then they start all over again. The difference with heartworm, Dirofilaria immitis, is they don't lay eggs. The adults give birth directly to these first stage larvae. As we said, it's a nematode, just like these others. Heartworms have an indirect life cycle. They must develop in an intermediate host. If there were no mosquitoes on the planet, there would be no heartworm, because the heartworm enters the mosquito when it's a first stage larva. when the mosquito sucks the dog's blood. And then in the mosquito, that's where the first stage larva develops into a second and then a third stage larva inside this mosquito. And that third stage is the infective stage. If a mosquito bit your dog and gave your dog microfilaria, they would never develop into heartworm. It's only that third stage that has to go back into the dog and then can develop into adults. So as we said, now the mosquito has carrying a third stage larva, and that can be spread to some new canid, a dog or a coyote or a fox. And then in that new dog, in a few months, it will develop into a fourth stage and then a fifth stage larva. And then over time, it'll reach adulthood and live in the pulmonary arteries and the left ventricle. I wonder earlier if the cat, I wonder if I meant to say, oh yeah, I wrote right and left pulmonary arteries. Okay, we're good. Now, do you recall how the heartworm test works? Maybe you've done one, you take some blood and you mix it with this diluent, or you just put 3 drops of red blood and 4 drops of the blue, or this one's 1 drop. Anyway, and then you end up with, if the dog does not have, or the cat does not have heartworm, you get the control line. If they do have heartworm, you get the positive line. So just to put it simply, the way it works is it's detecting an antigen, right? An antigen is some foreign substance. And the antigen it's detecting is the female heartworm's ovary. So it does not detect male heartworms. It's only detecting the female heartworms. Most dogs, they are going to have, 7 or 8 heartworms or more, right? One of these worms is going to probably be female. And so the test will detect that. We still want to do a confirmatory test. It's basically asking a second opinion. And so you can do, some places will just look at a drop of blood. You can concentrate that blood. You can concentrate the microfilaria using a modified Knots test. We might just send the sample off to a lab and let them run a sample. Before you embark on the expensive and aggravating treatment in dogs, you do want to confirm that the dog really has heartworm. What are some of the signs in dogs? Certainly, some dogs show no signs at all, and we're not always sure why. Some dogs will be coughing and be kind of out of breath, what we call, or just they're not very active, what we would call exercise intolerance. Some dogs are in full-blown heart failure, and they can have so many worms that they have this condition called the cavil syndrome, where we actually have to surgically, you'd have to go in and remove the worms. Again, just showing you the life cycle here. You can use this as reference. To diagnose it, other things we see, maybe not to diagnose it, but to try to determine the severity, you will see these are the pulmonary arteries, the left and right pulmonary arteries. We call them the cowboy legs or the cowgirl or bow-legged pattern. They're just these kind of big, prominent arteries. You normally would not see these on an X-ray. And this is just showing you the cavil syndrome. Let's just read this. There's such a large number of heartworms that they entwine and they pass through the tricuspid valve. Ugh, that sounds horrible. So these require surgery before you start anything else. You may recall that certain parts of California have more heartworm than others, right? This area in red and these areas in red have more heartworm. other parts of the state have very little heartworm. The reason is the mosquito that transmits heartworm is called the Western treehole mosquito, and he and she really likes this particular oak tree that is found in the foothills and found in the coastal foothills. This tree is not found in large numbers anywhere else. So it's a particular kind of oak tree. Heartworm is helped by this weird old bacteria called a rickettsia. That's the kind of bacteria. The name of the bacteria is Wolbachia. I believe that's how it's pronounced, Wolbachia, even though I called it Wolbachia for about 20 years. And cats can get heartworm too. There's Wolbachia, this weird little bacteria. It lives inside the heartworm. So here's a heartworm, and this is supposed to be Wolbachia inside it. So they live in harmony. This is a symbiotic relationship. And the Wolbachia somehow confers certain benefits to the heartworm. It's protective. It helps the heartworm to reproduce. They've done studies where without Wolbachia, the female heartworm cannot reproduce. That's so weird. Without Wolbachia, L3 cannot infect a new host. So if we could give every mosquito some treatment for Wolbachia, that would prevent heartworm, I guess. Also, these Wolbachia are, they have these little inflammatory proteins so that when the adult worms die, the inflammation is more severe, and that can be dangerous. That can cause anaphylaxis, where the airways all constrict. It can cause a thromboembolism to form, and that would, cause a stroke in the lungs. So Wolbachia is bad. I hate Wolbachia. Luckily, we can treat Wolbachia dogs with heartworm. Part of the treatment is to use one of the tetracycline antibiotics, typically doxycycline or minocycline. By limiting the growth of Wolbachia, it will weaken and soften the heartworm so that we can go in with for the kill. Tetracyclines, they don't really kill anything. They don't kill Wolbachia. They are what we call bacteriostatic, meaning they just limit their growth. But then the dog's own immune system may be able to help kill them. Well, I take that back because they're inside of a freaking heartworm. We just know it limits their growth. And tetracyclines have some other cool powers. One is they tend to accumulate within cells, and that's part of why they're used to treat organisms that like to hide. So Lyme disease is another organism that tends to hide in cells, and the immune system doesn't detect it very well. So that's one special power of tetracyclines. Maybe so it accumulates in the heartworm. I don't know. I guess eventually they die of old age, the Wolbachia. I don't know. Tetracyclines also possess anti-inflammatory properties, which is pretty cool. Okay, so that's part of treatment is doxycycline. We also want to eliminate all the life stages. You may recall that heartworm preventives, they don't kill the adult. So we need to treat with an adulticide. Sometimes we actually need to stabilize these patients with fluid therapy before we do anything. I'm not going to go here, but the American Heartworm Society is a great resource. Whenever I have a case of heartworm, I go there first just to see if they've updated their treatment protocols. So I recommend you check them out. These dogs also have to be cage restricted And there's some good advice there about that. You can't have them running around. If you've just given them an injection to kill big old worms in their heart, you can't then say, all right, go run around like a crazy man, because the big chunk of dead worm could come loose and act like a clot. So we need to restrict their activity, restrict any overheating, to prevent that from happening. So this is the worst part of treatment. The injections in muscle are bad enough, but sticking a dog in a crate for 8 weeks, that will drive everybody crazy. Okay, that's dogs, right? And this is, they're giving the adulticide injection. That's that arsenic called, it's called malarsamine, or the proprietary name is imidacide. The subtitles are very goofy. Okay, so let's talk about cats. It's a totally different disease in cats. Cats get it too. Cats are a dead end host. The heartworm is not going to develop and be spread to other dogs or cats. So they are an aberrant host or a dead end host, but the heartworm still does some damage in them. It still moves and lives into their heart and lungs. The disease is actually more severe in cats. That's the bad news. The good news, though, is that cats are more resistant to infection. Only about the infection rate is 5 to 20% that of a dog. And even if a cat does get infected, very few of the third stage larvae will reach adulthood. So cats with heartworm, they typically only have one worm or two worms, whereas a dog has 30. And these heartworms in the cat will only live maybe 2 or 3 years compared to 5 or 6 in the dog. What's weird, though, is the cat may only have one worm, but the response of the cat to that worm is much, much more severe. In fact, the death of just that one worm could trigger shock and cause a pulmonary thromboembolus in the cat. The clinical signs are different. So we mentioned that Tipitina was vomiting. She really was vomiting. She's not coughing, she's vomiting. This is Tipitina here. Heartworm can cause some familiar signs like coughing, but in cats, it can cause anorexia and vomiting. Those are not signs we usually see in dogs. There may be a systolic murmur, and sometimes the only clinical sign is sudden death. Your cat is fine today and they're dead tomorrow. That's listed as a symptom of heartworm disease. It's not a very helpful symptom. Diagnosing is a little harder. The ELISA is great in dogs. It's not great in cats. We get false negatives. Why do you think that is? Remember, the cat might only have one worm. What if it's a boy, right? The heartworm test will never detect a boy. There are antibody tests. So if a cat gets heartworm, gets exposed to heartworm, his or her immune system will make antibodies, right? They're coming out with an antibody test for coronavirus. Well, the problem is exposure does not equal infection. If a cat has antibodies to heartworm, it may just mean they encountered heartworm and then they resisted it. So it's not a perfect test. You get false positives. You may see a lot of eosinophils on a CBC. That suggests it's heartworm disease. So if we have a positive antibody titer, if we have eosinophilia, And if we see maybe enlarged pulmonary vessels, that is supportive of the diagnosis. But if you really want to confirm the diagnosis, you want this. So this is another echo of a heart. In other words, it's an ultrasound of the heart. So there's a pulmonary artery, and you're going to see, it's not going to look like the worm, because remember, this is a two-dimensional image, but you'll just imagine worms crawling around in here, and you're going to get little glimpses of them. Right, those little hyperechoic worms, you see them? Can you imagine, 4 or 5 worms crawling around in there? I don't think there's worms other places, but there might be. To watch that again, maybe. Is it? Like, is there a worm down here? Like, is that a worm? I don't know. Anyway. Okay. So treatment. Well, let me go back to signs. So one common sign is the worms will cause so much inflammation in the airways that these cats will have, it looks like asthma, but it's not. Well, it is asthma, but it's not caused by pollen or perfume. It's being caused by heartworms. So you can't treat the worms. All you can treat are the symptoms. So when they say there's no treatment for heartworm in cats, this is what they mean. You can treat with glucocorticoids. That helps with inflammation. You can use albuterol. These are the same medicines. Remember at the very beginning, I showed you the cat and the horse, and they both had those puffers. Those puffers could contain glucocorticoids or albuterol. But that's all you can do. And keep the cat, hopefully the cat does not experience sudden death. And hopefully in a few years, he'll clear his own immune system from these heartworms and get the cat on Revolution or some heartworm product. All right, our final case, Pyewacket. Again, you can take some time and look at his case, her case. Okay, 11-year-old female spayed domestic shorthair, chief presenting complaint, acute blindness. And the owner reports she's also had a slightly reduced appetite and she's been losing weight. Physical exam is unremarkable other than a negative menace. When you try to do that to her eyes, there's no response. Blood work reveals a mildly elevated SDMA, BUN, and creatinine. Urine specific gravity is 10-15. The rest of the UA is within normal limits. CBC is within normal limits, and FELV, FIV test is negative. So she is in some kidney failure. The veterinarian wants to rule out hypertension secondary to kidney failure as the cause of Pyewacket's blindness. So let's talk about that. So first of all, how do you get a good blood pressure reading in a cat? And I'm sorry if we've already talked about this. Obviously, this cat here, even if he's totally normal, is probably going to have high blood pressure. So there are just some standard tricks or tips when obtaining blood pressure in a cat. What piece of equipment are you going to use? Are you going to use the oscillometric or the Doppler? Which one's more accurate for systolic blood pressure? It would be the Doppler. So that's part of why we had you practice using Doppler every time. So you'd have your Doppler ready, have it all ready before the patient arrives. Try to schedule this at a time when there's no big goofy dogs around. Try to schedule it in the morning if possible. Sometimes we'd have the owner come in a back door and a nice quiet room, with lots of feel away, no noise, and have everything ready. And the cat, we shave. Sometimes we use some artery, the coccygeal artery, I guess, on the tail, or we use the foot. And you want to get, I think you do, I want to say you get at least 3 readings. Gosh, I want to say it's even more than that. I want to say you take 5 readings and then you throw out the top one and the bottom one, and then you get like the average of the middle 3, but I have to double check that. The point is, you don't just take 1 reading, you're going to take several, and you're going to ignore the top one and the bottom one. And I know, I apologize. I know one of you, either Sabrina or Sarah, is going to talk about stress-free. I'm sorry if I've got that wrong. So anyway, whatever we can do to reduce stress will get you a more accurate blood pressure reading. And we're going to find that piewacket has hypertension, and part of the treatment is going to be to decrease systemic vascular resistance. But first, we're going to look at some definitions and causes and effects of hypertension. You may know in people, hypertension is called the silent killer. And if every time you go to the doctor or the dentist, they often will take your blood pressure because they want to know if you have hypertension. McKernan defines systemic hypertension as a systolic blood pressure, right? Systolic, that's the pressure generated by the left ventricle, as being greater than 150 millimeters of mercury. Now, other sources, though, would call that maybe early or mild hypertension, and they would call 180 would be a more severe hypertension. So so just note that. Also, please note that some sources also give a normal range as 110 to 160. So if one source says 160 is normal and McKernan is saying 150 or is saying that 160 is hypertension, obviously we have to interpret other events or interpret other signs as we interpret these blood pressure readings. If piewacket had a blood pressure of 150, I might think there's some other cause for his blindness. But if it was 180 or 190 or 200, then I would think, okay, that might be the cause. What can cause hypertension? Sometimes in dogs and cats, it's idiopathic, right? There's no other cause, and we would call that primary hypertension. But there are, not always, but sometimes there are all sorts of secondary reasons for hypertension. So kidney failure, it's very complicated why kidney failure causes hypertension. You would think you'd have the opposite problem, but it's a long story. So kidney diseases can cause hypertension, diabetes, Cushing's disease, obesity, hypothyroidism. Theochromas, those are little adrenal gland tumors that are making too much epinephrine. And then, and I have never heard of hyperaldosteronism, but apparently it's a thing. And this, when your blood pressure is so high, it can cause seizures. It can cause damage to the retina that causes blindness. It can actually wear out the kidneys and lead to worsening kidney failure. So it can have a lot of bad effects on your patient. Well, what do we do about it? We can use a drug called amlodipine. Now, there's lots of drugs that can lower blood pressure, right? Acepromazine lowers blood pressure. Pimabendin, acepromazine, they all lower blood pressure. The problem with those drugs is they are going to dilate either veins or both veins and arteries. Amlodipine is unique in that it dilates only arteries. And that helps explain its benefits. So it's going to work on calcium. And calcium, you may remember, it's important for hemostasis, right? Clotting factors need calcium. Calcium is used in your nervous system. It helps trigger the release of neurotransmitters. And it's also important in every muscle function, whether it's smooth muscle, cardiac muscle, or skeletal muscle. Calcium helps allow those two filaments in muscle to bind and then um, um, contract. So what does amlodipine do? It's going to reduce the movement of calcium into the smooth muscles of arteries. Um, that prevents the smooth muscle from contracting. And if the smooth muscle can't contract, then it can't constrict, right? So it's going to stay dilated. So now we're dilating these arteries. That's going to reduce the systemic vascular resistance, having all these dilated arteries, and that's going to reduce blood pressure. And it's not just peripheral blood vessels, it's also going to dilate blood vessels to the heart. And that's great because it's going to increase the supply of blood and oxygen to the heart, at the same time reducing the workload on the heart because it's reducing blood pressure. So that's pretty cool. So to review, blood pressure is determined by several factors: heart rate, stroke volume, and systemic vascular resistance. Systemic vascular resistance refers to peripheral vasoconstriction and peripheral vasodilation. I might be oversimplifying, but that helps me to keep this straight. Peripheral vasoconstriction is why your sweetie pie's hands are so cold, and he or she loves to startle you with them. The renin angiotensin aldosterone system is a magical life-saving sequence that causes peripheral vasoconstriction and increases blood pressure. But the RAA system is doing more harm than good to patients in heart failure. The kidneys respond to all cases of hypotension as if you were bleeding to death or dehydrated. The kidney does not realize hypotension can be due to heart failure. And this very common expression you may hear: what's good for the kidney is bad for the heart, and vice versa. This, by the way, this is the actual pie wacket in the Jimmy Stewart classic Bell Book and Candle. I don't actually know if it's a good movie or not, but that's just a great name, pie wacket. Anyway, ACE inhibitors, they work by inhibiting a key enzyme in the RAA sequence. So that's going to prevent peripheral vasoconstriction. Yay. We love pimobendin, the only inodilator in veterinary medicine. Heartworm disease causes right-sided heart failure, and cases can range in severity from asymptomatic to the horrible Cavel syndrome. Wolbachia provides many benefits to its heartworm host, and successful heartworm treatment depends on killing, or I guess I should say preventing, the growth of Wolbachia. Heartworm in cats presents some unique challenges in diagnosis and treatment. Companion animals can develop hypertension for different reasons. Obtaining accurate systolic blood pressure readings requires great cat diplomacy, and amlodipine is a helpful drug for treating hypertension. It's going to dilate arteries, including not just peripheral arteries, but as well as that arteries to the heart. And I realize you don't have the quiz thingy, so I will get the correct answers up there. You can check your answers again if you would like. And if you have any questions, email me and call me. I will see you hopefully next Wednesday in some way, shape, or form. Take care.